Come in.
Good afternoon, Dr. Mitch. It's a pleasure to meet you. My name is Nick Cerda.
Good afternoon. Pleasure to meet you, Mr. Cerda.
I would like to start by saying that I, along with my company, Pernix Therapeutics, appreciate it that you have taken time out of your busy schedule to meet with us today.
Absolutely. Thank you so much for having me and keeping me in mind. How's your day been so far?
It's been pretty good. Just running around the office, meeting with some clients. Can't complain any day that we have weather as beautiful as today.
Absolutely, especially at this month in November.
Definitely. You can't expect it to happen in November, but we will gladly take it.
Absolutely. I hope it lasts until the rest of the year, that's for sure.
I would like to start off by saying that I, along with the rest of the company, respect and admire the credentials that you've built throughout the community with both your fellow peer practitioners as well as your patients. And it's for this reason why we would like to present you with our new and improved prescription migraine medicine called Trexamet.
Oh, wonderful. I gladly appreciate it for keeping me in mind. Let's hear out this proposal first.
Definitely. I would like to first start by saying that I, along with the entire company, we value both efficiency in our products as well as safety for our patients. So with that being said, I gladly state to you that our drug Trexamet is already FDA approved, as well as being the focus of a 16-year study held by the American Headache Association, which proved both its efficacy as well as its safety, which we take very seriously.
Yes, I highly take that very seriously as well. It's a good thing you guys have that.
I would like to start by asking you a few questions about yourself as well as your patients, just to gain a little bit more insight.
Absolutely, go right ahead.
The first question I would ask would be, what generally are the prescription medications that you prescribe to patients that suffer from migraines?
Usually, it all depends on the type of migraines they have. We try to be precautious about that, so I always prescribe two of them, which is the Imitrex and Maxalt.
Definitely. We are very familiar with both of those drugs at our company, and that leads me to my next question, being which situations you would prescribe each of those drugs?
Imitrex is an excellent choice for an acute migraine itself. They might need another medication to prevent headaches, while Maxalt is great for relieving short migraines, but doesn't work as well for long-lasting headaches.
Definitely. That is what we are generally normally hearing about both of those drugs. And is it normal for you to see patients that suffer from both the short acute migraines that you treat with Maxalt as well as the long-term migraines that you treat with Imitrex?
Unfortunately, migraines tend to be unpredictable, and for this reason, I generally prescribe both. Taking a dose as early as possible after symptoms begin. If taken early enough, they often reduce the severity of the headache or stop it completely. A lot of the people don't take it until the headache becomes really bad, but at that point, it's often too late for the painkiller to work well.
Definitely. That is very unfortunate for the patients that they kind of have to go through that trial and error. Speaking of that trial and error, do you believe that they can continue to afford, realistically, the trial and error approach to relieving symptoms of migraines?
No one can afford losing any amount of money, especially taking a risk with medication. Migraines are frustrating. They can become a burden to your social and professional life. But everybody gets headaches. It's become easier for the health insurance to be a big help in pertaining most of this, especially because 36 million Americans suffer from migraines. Therefore, the cost of the medication has become more manageable. Especially if it guarantees better results as for their current medication, especially for the medication that you're suggesting as of right now. People are willing to spend whatever it takes to end their misery.
For sure. It's with this unpredictability that the migraines have that pretty much our company had in mind when developing this new Trexamet medication. So with that being said, I would like to list to you a few of the benefits that our new drug is currently resolving.
Absolutely, go right ahead.
The first one I would like to present to you would be the reaction time that it takes for symptoms to start being cared for, and that would be 15 to 20 minute relief time, which is very comparable to the prescription that you normally prescribe for the short-term migraines, Maxalt.
Right.
But unlike Maxalt, where it doesn't treat the long-term migraines that come with chronic migraine symptoms, Trexamet also has a lifespan that surpasses 2 hours, which on the other hand is very comparable to Imitrex. So essentially it's the best of both worlds for both of those drugs. So one pill, one dosage, 85 milligrams, and it pretty much knocks out the symptoms of both those short-term migraines as well as the long-term migraines, but the benefits don't stop there. Where most triptans only treat migraines after they happen, our new Trexamet is a hybrid of both sumotriptan, which is essentially the Imitrex that you already prescribed, as well as naproxen, which is an anti-inflammatory medication. So where those two only treat the problems after they arise, the naproxen also relieves tension headaches that triptan medications do not, as well as providing some relief before they happen. So it has some prevention measures.
Oh, okay. Yeah, people tend to take so many of these pills all in ones and multiple times a day just harms the rest of their organs.
Definitely.
So with you saying that one time a day would be more beneficial for them, especially for twice as much as the intake of medicine that they're taking right now, it benefits me and the patients itself.
Exactly. That was our thought process in developing this new prescription.
Now, I would like to ask you a few questions myself.
Of course.
For some people, obviously everyone's body reacts differently to different kind of medicine.
Right.
That's why I've been so picky with who I prescribe my medication to. I heard that Imitrex is part of the Trexamet, right?
Yes.
So therefore, they're not dropping completely both medications of mine, nor are they taking one of them with along the new medication. What are the risks that they're taking or they're facing if they completely drop my medication and go to the Trexamet?
Right. So you're asking what are the risks if in switching from either Maxalt or Imitrex and going to our new Trexamet?
Correct.
Well, like I said, Trexamet is a hybrid of the sumotriptan, which is essentially Imitrex, and also the naproxen. So when switching from the Imitrex to the Trexamet, the only complications that will arise will come from the naproxen. So as long as the patients are in the age frame, without the risk factors, and also healthy enough to take the naproxen, no risks, if any, should arise from switching to the new medication.
Okay, so we're still staying in the same age range as no younger than 18 and no older than 65.
Definitely. We leave it subjective up to the professionals for consultation so they can see, because like you said, every patient is different, so that's where we allow you to use your discretion. But generally, we do not recommend the usage for Trexamet for patients younger than 18 or older than 65 just due to the risk factors and just the nature of a triptan, being that it regulates blood flow and any complications that can arise from such factors.
Right. What would the long and short-term side effects be towards my patients once they switch to Trexamet?
Definitely a good question. I'm glad you asked. As far as the short-term side effects, they include dizziness, irregular heartbeat, numbness, dry mouth, and tightness in both the chest and throat. While those are obviously still being worked on, it is important to remember that all triptans pretty much have the same side effects. So it's impossible to eliminate all the side effects. Our job and our goal is to minimize them. And as for your long-term side effects, they include heart disease, stroke, and blood clots. And like I was saying earlier, with triptans being regulators of the blood flow, these are pretty much just the products of the method in which we use to treat the migraines. So as long as we leave it up to the professionals, such as yourself, to regulate the risk factors and to make sure that these drugs don't get into the wrong hands, these side effects, risk factors, long-term and short-term side effects will be negated or at least kept to a minimum.
Right. Now that I know that the medications that I'm prescribing aren't at their lowest price, cost is a big concern to my patients and I. How much more are we looking at if we switch to Trexamet?
Definitely. Well, cost is definitely a big concern to us as well, being that insurance is such a hot topic these days. I can tell you right now that Trexamet is being sold for 85 milligrams at $80 per pill, and that is without insurance, whereas Maxalt for 5 milligrams only is $38 per pill, and Imitrex for 25 milligrams is $29 per pill.
Okay.
So in order for me to kind of give you more of a visualization of the benefits and savings that switching to a Trexamet, which only is one dosage, I would like to give you a little bit of a visualization of that.
Yes, please do.
Okay, so I'm going to start by showing you that usually with the Maxalt, because it's such a short-term resolution,
Right.
it's very simple to assume that they would take 2 doses for one migraine, being that it's not too chronic, and 1 dosage of the Imitrex, which would equate to $115, and that would be for 1 day's relief, whereas the Trexamet has the ability to relieve all the symptoms of the migraine as well as prevent further ones with $80 per day. So if we assumed, with a chronic headache being the case, that 7 days out of the week or 7 days out of the month that they suffer from these symptoms, if we multiply that 115 by 7, that comes out to $805 per month for the combination of the Maxalt and the Imitrex dosage.
Without insurance.
Without insurance, of course.
Okay.
And for the Trexamet, if we assume the same conditions, 7 days out of the month, they resolve their symptoms, that would come out to a total of $560, which is almost $250 in savings by just going to fewer pills, quicker resolutions, and also less responsibility left on the patient to diagnose themselves.
Absolutely. That sounds like a much better offer for them.
Definitely, and it's with these benefits of the short-term relief, the long-term relief, as well as the single dosage, as well as the prevention caused by the naproxen, it is that I offer you both a in-office sample as well as take-home samples if you would
Wonderful.
be interested in giving these to your patients at your own discretion.
Absolutely. Thank you so much. I highly appreciate it.
And also because you're so respected in the community and with your peers, I present you my business card in case you have any doctor friends or in your network that may benefit or have patients that may benefit from our new drug.
Thank you. I was going to ask for your business card, and I'll definitely more than likely spread the word around.
Well, thank you. I hope you have a good day. Thank you for meeting with
Thank
me
you.
again.
Enjoy the rest of your night.
You too.
Thank you.